This is an EEG of a 69-year-old woman with a history of a right temporal glioma and episodes of altered awareness. When we look at this, we see that the montage we're looking at is a double banana montage. This is left parasagittal, right parasagittal, left temporal and right temporal. And we have all of our typical settings here with the filters between 1 and 70 hertz, 60 hertz notch filter, and our typical sensitivities. So when we first look, we want to take a look at the posterior dominant rhythm and count the frequency. Now on this page we can see that the patient's eyes are blinking a lot here, and the text says the patient's eyes are closed here, but it sure looks like there's a lot of blink, so we're going to have to look to see if we can find a good place to count the posterior dominant rhythm. Here it looks like she's drowsy. We don't, it looks very attenuated, and we're not seeing a good posterior dominant rhythm. When this happens, you just have to look for your best, do your best and find a place where you can count. And so here, we can just try to count this here. It looks like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, around 10 hertz. Sometimes it looks like it's a little faster. So that's the background frequency. Now what about the background amplitudes? So it's definitely lower amplitude, but again, this patient's probably a little bit sleepy here, and if we measure, we would probably get around maybe about 10 to 30, 10 to 20 microvolts. Now let's talk about the symmetry of the background. If we look in these parasagittal head regions, it looks like in terms of the symmetry, the background frequencies look pretty similar here, and the background amplitudes look pretty similar. If we look in the temporal regions, and this may have already caught the eye of some more experienced EEG readers, we can see there's a difference here. There's a difference in the background amplitudes from the left to the right. Now on the right side, we know that we can see higher amplitudes in most people, but look at the difference here. This is more than a 50% difference. If we measure this, that's about 40 microvolts. And if we measure these tiny little waves here, that's 16 microvolts. So that's a significant difference in terms of the symmetry. So we've got higher amplitudes over the right hemisphere. Also, if you just look at the background over the right side, it just looks a little spikier. There's more of this faster activity here, higher amplitude, irregular appearance. Now this is what we call a breach rhythm. This is persisting throughout the recording. A breach rhythm occurs when there's a skull defect. When there's a skull defect, we have lower impedance in that area. There's unfiltered brain activity coming through, and so the amplitudes are higher. It often can look spiky, and we often see more fast activity on that side. You have to be really careful when you're looking at a patient with a breach, because things can look sharper and it becomes easy to over-interpret and overcall. So this is just part of the breach. It looks spiky, it looks like it's pointing at each other, but that's not epileptiform. That's just part of the breach rhythm. It doesn't really stand out from the background. If there really were true epileptiform activity here, it would be really high amplitude. It would be really standing out from the background. You'd see a slow wave after it. It wouldn't just oscillate at the same frequency as the rest of the background. All right, as we are going on here, we just continue to see this breach rhythm. So far, this patient has been awake the whole time. She definitely looks drowsy. We haven't really talked about other features of the background that we do need to discuss. So we didn't talk about the reactivity to eye opening or eye closure or other environmental factors. And we also didn't talk about the organization. So the frequency amplitude gradient, I would say it's fairly organized. I mean, we see a little bit of a gradient, but it's not the best compared to other EEGs we've looked at. I do think the patient is drowsy here, and we can see the eyes going back and forth. And with that, we do see we don't see the frequency amplitude gradient as well when patients get drowsy. So that's probably the case here. If we saw her when she's really alert, it probably would look better and more organized. It does look well organized here on the side of the breech. So this patient has a history of a glioma that was resected in that area. So she does have a skull defect in that area. So more blinks here, and so far the patient has been awake. We did see some drowsiness, but we have not seen any clear sleep. Now, this is an example of reactivity. We can see the EEG change from here to here when the eyes open. This background is more attenuated. Then this is all just diffuse muscle artifact here. Here her eyes are open, blinking, and then her eyes close. Very sleepy. And this is the photic stimulation. So the tech is flashing the light. We're looking for any photoparoxysmal responses. I don't really see much of a photic driving response here. Maybe a little bit here. If we look at the background activity here, then the flash. So there's probably some photic driving here, and then after the flash, we see the background reverting back to normal, to its normal frequency. And maybe a little bit here as well. Again, the presence or absence of a photic driving response is really not overly significant. We're looking for abnormal responses. And the presence or absence of driving doesn't really matter. All right, so that's the end. So this is an abnormal EEG in the awake and drowsy states due to the presence of a breech rhythm. Now, when we do our EEG reports, we want to say what the abnormalities are and what the clinical significance of those abnormalities is. So the abnormality is a breech rhythm over the right posterior quadrant, and this finding is consistent with the patient's known history of a skull defect, and no epileptiform activity or electrographic seizures were seen.